hike. Okay, we got Senator Nicole Akins-Boyd. How you doing, Senator?
Good morning. How are y'all?
We're doing great. We appreciate you joining us today. You got a lot of titles there in the Senate, and I had a hard time getting that out the way it's written on my sheet here. But and you've had a busy session. That's why we asked you to come on and talk to us.
We have had a really busy session. We have this last summer, I was kind of honored to be asked to chair the Women, Children's, and Family Committee. And we met pretty extensively. I individually had over 50 meetings with different people across the state. And our committee met through a lot of hours. And so we were pleased, really, that we hopefully have really made put some significant pieces of legislation forth. We had about 11 pieces of legislation that passed, both Senate and House bills that we all kind of worked on together. And so we are very hopeful of some of the things that we're doing that we hope will make a tremendous amount of difference in the future for women, children, and families. And two of those particular issues, we've got two big task forces that are going to continue to meet to make sure that we are really doing all we can to help issues, particularly one on adoption and foster care system. We kept hearing from individuals across the state of Mississippi about issues that they were having with adoptions and also issues that we were having in our foster care system. And so we have one task force that will really begin to really tackle that particular issue and really kind of do an in-depth study of some of the things we need to do in foster care. And then another issue, one that I'm really passionate about, is a task force that's going to be looking completely at early intervention. We know that early intervention is incredibly important. We've discussed this. You've had me on before, but one of the largest return on investments that we can make is in early intervention. We know we get to these kids early. We know that we help them with the particular issues that they have, and we know that these kids can go on to be very productive citizens in our state. And so we want to make sure that we're doing all we can for those kids. And we know that our numbers are really low in that arena. Last year, I think we served 1,652, and we really should be looking at about 10,000 children in that arena. So we've got some exciting things coming forth. We've got just a number of issues. We've extended postpartum coverage, which we think is really important for women to help them get healthy after they've been pregnant for 9 months, and then make sure that they're really healthy, able to take care of their children, and then hopefully help them make sure that they're healthy to get back in the workforce, because we know that workforce is very important to our state. We've also we expanded adoption tax credits, which I think is super exciting. If you adopt a child that's from within the state of Mississippi, we've raised that adoption credit to $10,000. So that's very exciting, really, to get people looking at adoption in our state. And one of the other things we did was we increased the tax credits that are allowed for contributions to our crisis pregnancy centers across the state. We also really increased the contributions that our organizations could make when it looked at child care issues. And so we really kind of looked at that as what employers could do to help their employees. Because as I go around and tour a lot of the industry that I have in their area, there's two consistent things that our industry say they need help with. And those two things are they need help with financial literacy for their employees, and they need help with with child care, helping to make sure that their employees can get that really good child care in their area. And that seems to be a consistent message, no matter if you're in Panola County or Pelahatchie. That's two things that we kind of see consistent across the state.
Okay, so what exactly was done as it pertains to child care? There's some additional tax credits that were enacted?
There's some additional tax credit. So right now, a lot of our businesses are unaware. There's been a tax credit available to businesses that offer on-site child care. And we only had a few businesses doing that in our state. What I found out in the process is a lot of our businesses did not know that that was available to them. But we also added a 50% tax credit to employers that directly provide child care on-site or providing a child care stipend of at least $6,000 to a licensed child care entity within the state.
Okay.
So this really kind of helps employers if they want to help the employees be able to offer child care. And we know that, child care used to be something that was not really talked about in the workforce. People who, those were kind of issues that were kind of handled. We know now in the economy where getting workers is challenging and getting great workers is even more challenging, that employers need greater tools to be able to help their employees and really attract those top-notch employees. And looking at this child care issue is very important for those employers out there. So we're excited to see kind of what this can do, and I think you'll see us continue to this and see how we can partner with our employers out there to see how that they can help their employees, and in turn how we can also help them as well.
Yeah.
So I'm really pleased to see that we're continuously looking at these real workforce issues within our state. Some of the other things we did too is we really extended legislation on our safe haven laws. And a lot of your listeners out there will kind of know these as the baby drop-off laws. Prior, what we used to have in our state before we've kind of changed this law is that basically you could, if you wanted to surrender your baby, you could do this. You had basically a 7-day window that you could surrender that child, and you needed to do it basically at a fire station or a hospital. And so we extended that period of time to 45 days. And we also then allowed, if communities wanted to go together, to put in what's called baby boxes now. They'll be allowed to put those at hospitals or fire stations. I think Ocean Springs has already got their baby box ready to go. It also, the bill allows a parent to call 911 and surrender their child to any emergency medical provider within that 45-day time frame. And this is important because you see across the country, we've seen in our state where children have been, abandoned, and they, perished in that process. And we want to make sure that if somebody, needs to surrender a child, and we hope that that never happens, but if they need to, that there's a way for them to safely be able to do that.
So the idea here, Senator, is for them to do that without shame and without any sort of legal repercussions and consequences.
Absolutely. And it provides them basically complete anonymity in the process, and allows them to do this and allows them to do it without shame. Yeah. And so this is, I feel like this is a very compassionate piece of legislation that's both good for the child and good for the surrendering parent.
Yeah. We're up against a break right here. Can you hang around? I want to talk about where we go from here with respect to Medicaid disenrollment. You hang around?
All right.
All right, we got Senator Nicole Akins-Boyd on the line here. We're in the Element Wealth studio. Hero. We are talking to Senator Nicole Akins-Boyd, represents Lafayette and Panola counties. So, Senator, there was some action during the session to address what some have described as a healthcare industry community in our state that is at crisis levels. Certainly, Dr. Edney from the Department of Health has informed that there's some 28 rural hospitals that are in very troubled financial condition. So we had, I guess, 3 measures to my last count that were designed to somewhat alleviate some of this pressure, some of these financial problems, but I'm not sure that's going to be sustainable long term. What do you think?
Well, there were some short-term gaps. There were some short-term fixes done. We did pass kind of a a large kind of package for our hospitals in the state. It's one-time funding dollars to try to help many of them get back on their feet, a number of them, particularly with higher costs of doing businesses, higher cost of nursing staff, and the higher cost of everything. They're kind of in a financial crunch as we looked at this. And so we kind of did a one-time fix of kind of $100 million that it goes out to the hospitals across the state. But I think you bring up a really good point in the fact of hospitals are having to pivot. They're having to look. They're having to change the way that they're doing business. I think you see a number of hospitals that are already have begun to make these pivots to see really what those things they need to do to how they sustain themselves in the future, and look at those services that that they need to provide and are cost effective for them to provide. And then we have to, and I think that's going to be an ongoing talks that we're going to be having throughout the next number of years is, what does healthcare look like in the state? What do our traditional community hospitals look like in our state? What are the services that are essential that they need to be providing? And then how do we translate to all of that? So I think these are really ongoing conversations that we're going to be having over the next few years as we kind of move forth. So.
Yeah. I mean, there seems to me like still, and I've said it many times on the program, the fundamental core issue that many of these hospitals face is just the provision of services that are uncompensated or severely undercompensated. So it's a revenue issue. Certainly they need to address the cost models. All organizations need to be constantly paying attention to their cost in place and how to make their organization more efficient, more productive, more agile. They need to address that. They need to do that. But there's only so much you can do to offset free, and that's what's happening. A lot of free services being provided.
Absolutely. When you look at the models, one of the hospitals that has had particular difficulty, when you look at and you realize that 90% of their care was really being performed at levels that really were not that they were able to sustain financially. That's a model that's almost impossible to see how that we're going to go forth with that. So, and I think you've seen there's been some particularly bright spots that I'm pleased to see. When I was running for office 4 years ago, there was a hospital that in Pinellas County that had gone bankrupt. They've got that up. They've got it going again. They've got it sustainable. And they're continuing to work to make sure that hospital is, that hospital is sustainable. Quentin Whitwell's doing a great job with that. And I think we're going to have to see that type of creativity and really pursuit across the state. I know he's helped another hospital in the area make sure that they're open for emergency room visits, and then be able to appropriately triage those patients and get them to larger centers for service when they need those services. And so I think you're going to see hospital systems continuously figure out what those needs are and how they need to serve patients. So.
Yeah, they're no doubt they're getting creative, and they're evaluating their cost and looking for ways to eliminate unnecessary or duplicative cost and bring those in line with revenues. But they still have the perennial problem of, again, delivering services for which they are not compensated and paid, and they've got to figure out some way to address that and deal with that. Speaking of which, we've got the continuous enrollment provision of Medicaid now has expired. April 1, states are compelled by the federal government to begin the process of identifying those on their rolls who were no longer eligible for Medicaid coverage and essentially terminating that coverage. It's estimated there are 100 to 120,000 Mississippians that may be booted off the Medicaid rolls. What are you hearing?
Well, and I actually talked to a representative from Medicaid yesterday about they're in the process of doing that. They're in the process of looking at eligibility on that. And that is a process, that's ongoing, is going to be continuing as they kind of look at and reevaluate that. So, I think that they're probably, there's not really, hardcore. We have some estimates yet, but we don't really know what that looks like until they kind of get more into this process. But they definitely are in the process of doing that. I talked to him yesterday, too, and as the legislature, we passed the postpartum expansion from the extension, from 6 weeks to a year. And they have gone in the process of trying to get approval for CMS for that right now.
Yep.
And so they have made an amendment to the state plan, and that they're waiting an approval from that. And they're hoping that approval will post date to April the 1st. That's what they've asked for. So they're in the process of kind of doing that. And that covers women up to 194% of the federal poverty level. Mm-hmm. So they're kind of in the process of doing that, and they've moved very quickly in being able to get that process done and started.
Yeah, of course, and we got the federal government now will begin to phase out the enhanced FMAP, the 6.2% that's been in place now for 3 years. That's phased out through September, so we're going to receive less money from the federal government, which places more financial burden on the state to cover that shortfall. And the only way to really make that work without appropriating more money to Medicaid from a state perspective is to reduce costs, and it's expected that is achieved by reducing the rolls and removing those who are not eligible. That's the dilemma. Right.
So, and then that plays into when you remove those people from the rolls and they go to their hospitals for care, then you've got more uncompensated care.
Exactly.
So it is absolutely a circle. We see actually in my household, because I have a husband who is a physician. Mm-hmm. So we see this firsthand on a daily basis. So.
Yeah, and it's not going away, and I got a feeling this will be front and center in the 2024 legislative session. And, of course, between now and then, we got a big old election. You're running for re-election for your seat?
I am running for re-election for my seat. So
okay.
I'm absolutely running and working hard. I had to get out of session, and I'm back now hitting it hard.
Sure. Do you have a primary opponent, Senator? I haven't checked.
I do. I do have a primary opponent. So we're out. This is the first time. It's been so nice to be able. We were able to last after session. My first 2 years of session was dominated so much by COVID, mm-hmm. And the ability to get out and see people. So I have thoroughly enjoyed being able to get out and see people really again. And even last summer, after we got out of the session, people were still a little hesitant, but that has gone away. And I've thoroughly enjoyed being able to really get back out and actually see them. I talk to them a lot on the telephone, but they are less, they're less reluctant now and are fully out and fully immersed, being able to get back into stuff. So this is going to be interesting because the last time I ran, I wasn't in office. And so doing this now and also balancing the responsibilities we have, while you're still in office is going to be a little bit of a challenge.
It's going to be interesting. I'm sure we'll be talking to you some more between now and election in August. It's just around the corner. Thanks for joining us today, Senator. Have a good one. We'll talk soon.
Okay, thank you.
We're coming right back in the Element Well studios. Half an hour of middays left. Stay with